Thank you. Okay, thank you, Madam Speaker. I am so proud to speak to this budget. I think the honourable member laid out the picture, the vision behind this budget extremely well. My colleague. And I want to follow up on it. I think the thing about it is this is a historic budget. It's presented by Canada's first female finance minister, and I'm proud because I can see the fine hand of that deputy prime minister in that budget, her thinking, her vision in this budget. Because it's a clear, logical, visionary budget, and it's laid out in 3 themes, as any logical budget would do. Because it's a budget about people. It's about protecting people. That's the first theme. It's about supporting people. That's the second theme. And it's about investing long-term in people. That's a third theme. Now, we're facing the greatest global human and economic catastrophe since World War II, and I think we need to remember that. This is not a crisis caused by some human error or economic mistakes made by others. It is caused by a virus that is currently now in full control. And I want us to think about the nature of this catastrophe, because we seem to lay blame in this House about who's responsible for what and why we are not controlling the virus very well. But with the exception of Australia, New Zealand, and Taiwan, every nation, every country is locked down right now, struggling against a third wave of mutations of the virus. And actually, Canada is holding its head above water by doing this. But as we hear fears raised against deficit and spending, etc., I want to ask my colleagues, should we have abandoned Canadians? Should we have abandoned the provinces for whom constitutionally the ability to deliver healthcare is theirs? We have not done that. We've invested, in fact, 8 out of 10, every $10 into the provinces, into vaccines, into giving provinces what they need in order to deliver the healthcare, personal protective equipment, testing and tracing and surveilling and ensuring that the basics of epidemiology is test, trace, surveil, and isolate where necessary. And that we have supplied the provinces with the money to be able to do all of that, but it is their duty under the Constitution to deliver on that. And so, I want to say what the IMF had said about our response, which is the first theme in this budget. And that is because Canada used public health policies that was grounded and guided by science and expertise, we were able to deal with the first wave of COVID in a very reasonable manner. The variants are the problem right now. And until we can flatten the curve, until we can get rid of COVID, nothing, no economic redevelopment, no starting of any economy, no transitions, no ability to plan for the future will be able to occur. So the first job one is getting that virus contained. And I think one of the things we have done when it first started, as the IMF pointed out, was to deal with this. We funded 8 out of $10 to the provinces. We gave them the ability to deliver healthcare in a manner that they felt fit for their particular province and region. In many cases, I would say we've seen across this country that many provinces have different responses. Some have done well, as in the Atlantic provinces, and others have not done so well. And that is because provinces are dealing with the healthcare on the ground in their provinces and their regions. And that's an important thing to remember. The federal government cannot suddenly impose on provinces and tell them what we think that they need to do. So I can carry on. This is a first part, protecting Canadians, which we have done extremely well. IMF has said that we are one of the countries that did extremely well using science and using expertise to do it. And I can sit down here and I can say we're putting $40 billion into this and $3 billion over 2 years and whatever into the things that we have put in. But I'm hoping you read the budget and you know where all that money is going and for what reason. I want to talk to you a little bit about the vision behind this budget, because the point is that while we were trying to flatten the curve and are still doing so in COVID, the second part of this budget was supporting Canadians, supporting workers, supporting families, SMEs, supporting seniors, supporting vulnerability in our things, supporting businesses, helping them to stay afloat. That part of the budget was about supporting Canadians so that they could survive, so that they could cope, so that they could, and businesses can keep, if not rising above it, because nobody can rise above it until COVID is gone, in helping them to tread water so that when the time comes and we are ready to move forward again and rebuild a new economy, they are able to hit the ground running. And that is why we looked at the wage supplement, at the rent supplement for people who lost their jobs. And that is why we looked at putting, increasing sickness leave. That's why we looked and saw what COVID exposed to us, which is all of the vulnerable in our society, all of the women who had to leave their jobs, not lost their jobs, had to leave it because they had to stay at home and take care of their children. All of the low-wage workers who were working in risky and precarious jobs, many of them full-time, and who still cannot afford to make ends meet. And that exposed that extremely well. And I think that is one of the reasons that we're looking now at supporting them with a $15 minimum wage, and of course helping them, workers, single workers, not just families, to be able to make use of the taxes that can help them, again, to keep their heads above water. We help seniors with money, and we're looking at how we're going to help them to continue to function by increasing the OAS for seniors above the ages of 75 and giving them a one-time amount of $500. So we're looking at housing. We'll buy housing just for people to help them pay their rents, not just businesses, but just families to pay rent. We're looking at how we put money into a rapid housing initiative to deal with all of the homeless, the people who have been displaced. We have put money into food banks to support people so that they can eat and feed their families. This is what this budget was about. It's about continuing to do that until we get rid of COVID, to help people to survive and to cope, and to help businesses to be able to keep afloat so that when the time comes, they can rebound. And the third part of the budget is what I can see this minister's fine hand in, our finance minister, because it's a visionary budget. It is talking about the future. It's building for a resilient future. This is not going to be our last pandemic. We don't know what's going to happen. Catastrophes will occur. We need to be prepared when they happen, not to have to fall apart like we did economically and socially. We need to be able to be resilient enough to bounce with whatever hits us. This is what this budget is doing in its third phase, which is building for the future. And the important thing about this budget is we're finding out that all the people who fell between the cracks are going to have to be held. So this budget is about looking at building a new social infrastructure so that we do not have to have people fall between the cracks again. And so we're looking at the people who have fallen and had fallen, and that was young people. We're looking at seniors. We are looking at helping seniors to survive and to be able to rebuild and to move forward. We're looking at tourism sectors, industries that have fallen apart, and that we want to keep them alive so that they can rebound again. And we're giving them money for marketing and for rebuilding. Businesses, small businesses, we are not only looking at giving small businesses the help they need to restart and to rebuild, but we're also looking at helping them into the new era. Because the new economic era that we're going to rebuild on is one that is based on post-industrial economy. And I have been on so many international fora where I have listened to Europe, who is now talking about a post-industrial recovery. It's not going to be the same old, same old. We're going to have to look at how we invest in the new economy, because we've seen in Europe, and they've talked a lot about how automation has actually begun to kill their industrial sector, and Europe has been massive industrial sectors. So we are looking at how we rebuild that on a new economy. So we're looking at science and technology and innovation. We're looking at harnessing our oceans. We're lucky. We're surrounded by 3 massive oceans. How do we get into that blue economy? How do we utilize our oceans to produce food and protein with low greenhouse gas emissions, with renewable food sources? Because oceans are not just about fish. We're going to look at how we develop that Although I might say I am very pleased to see that British Columbia, my province, got a lot of help with the salmon that are actually dying right now. And so we got enough money to be able to rebuild that particular resource. But the important thing to remember is that we are recognizing that this new economy is going to have to utilize young people who right now have no jobs. We have kept them afloat with summer jobs and all of the other things, but we're now trying to utilize and focus on youth being able to get their first jobs, being able to get into the kinds of training that they need, the new...
We have to go to questions and comments. The Honourable Member for Mission Mascouy, Fraser Valley.
Thank you, Madam Speaker, and I'd like to thank the member from Vancouver for her speech today. She talked a lot about all the things the government is looking into, but the one area where they're not looking into is first-time home buyers. And the federal government, I acknowledge, has put new money into housing. But if they do not address the structural economic challenges that young buyers, those young professionals graduating from the University of British Columbia, graduating from Simon Fraser University, who followed all the rules to get ahead, who did everything they were always supposed to do, now find themselves in Vancouver having to pay $3,000 a month for a crappy apartment. They don't want to live in social housing. These are independent-minded young professionals. They want a pathway to home ownership. And under the first-time home buyers plan, they're not getting that. Under this government, which acknowledged that the system works better for foreign buyers.
Vancouver Centre, an opportunity to answer. The Honourable Member.
Thank you for the question, because I think what the Honourable Member doesn't remember is that in 2017, after having gutted a housing strategy, this government put $40 billion over 10 years into housing. And since then, we have topped that up. Canadian Mortgage and Housing Corporation is back in the housing business because it had been taken away by the Conservative government. So it's back there. It's helping to support mortgages to help young people and first-time buyers. So this is happening. This is going on in a very difficult province like British Columbia to be able to help young people to get jobs. And I might add that we have been, one of the things that the IMF commented on is that we have been actually getting new jobs. And the new jobs, the rising number of jobs in British Columbia actually in the last quarter has been in technological industries, has been in the new innovation industries.
Questions et commentaires.
Questions and comments. The member for Beauport, Côte de Beaupré, and d'Orléans, Charlevoix. Merci, thank you, Madam Speaker, and thank you to the member for her speech. I would also like to recognize that it's the first time a budget was tabled by a woman in this House, and I think that every time there's a first on the part of a woman, we must recognize and salute that. So I'm doing that, and thank you to the Minister of Finance. I would like the member to tell us about the difference she sees between money being spent on seniors between the ages of 65 and 74 and money spent on seniors over the age of 75. Is her government treating these two categories of seniors differently?
For Vancouver Centre.
I want to thank the honourable member for that question. This budget is not only about supporting the vulnerable, but it is also about being able to recognize where those supports are best used at the moment. It shows statistically seniors over 75 most of them, I think 10% of them are in the paid workforce right now. Most of them are disabled. They're suffering from long-term health problems. And so they really need this extra support right now. It is shown that between 65 and 74, that in fact about almost 35% of that cohort are working and raising money and able to live and do have some ability to support themselves. So right now, we are supporting this very, very vulnerable group.
The honourable member for Edmonton Strathcona.
Thank you, Madam Speaker, and I'd like to thank the member for her intervention today. Like the member, I was quite excited to see the commitment to childcare. I think it's vital for women to recover from COVID-19, for our economy to recover. However, what I didn't see in this budget was anything on pharmacare. So despite the fact that the Liberals ran on this in 2019, despite the fact that the throne speech talked of pharmacare, there's nothing in this budget for pharmacare. So how can we believe that there's actually going to be real action on childcare when we've seen promise after promise on a number of different fronts not be fulfilled and just been dropped when it becomes inconvenient for this government?
I think
Member for Vancouver Centre.
Thank you, Madam Speaker. I think this member did not recognize that, in fact, both pharmacare and childcare are provincial jurisdictions constitutionally. And in order to get to where we were, if I recall, I remember under Paul Martin, we had negotiated a full childcare and early learning program with all the provinces. And we also had negotiated a colonial accord, and we had begun to work on a pharmacare strategy with the provinces at that time. And then, of course,
we have to resume.